This is Dr. Robert Watkins, orthopedic spine surgeon to professional athletes and creator of the Back Doctor app. Today's podcast is on treating professional athletes with spine problems. My father, Bob Watkins, Robert Watkins III, was really the first spine specialist to treat professional athletes and to specialize in that. He started with Curlin Jobe. Bob Curlin and Frank Jobe were two of the godfathers of sports orthopedic surgery in Los Angeles at the Curlin Jobe Institute. And then my father went to USC, where he still continued to take care of professional athletes. And then we've been in practice for about 15 years together. And together we take care of most every local Los Angeles sports team, the LA Rams, the LA Dodgers, the Clippers, the Kings, the USC athletic department. And we really specialized in athletes with spinal problems, both neck and back problems. 95% of all the athletes we treat non-operatively, probably even more than that. In fact, we review studies and MRIs and give advice to agents and trainers and doctors from all over the country on a regular basis, where we help them make these difficult decisions as to how risky is the person's condition, what's the chance of them having problems if they go back to play with it, should they have surgery, should they retire, and what should they do. It's a difficult situation. There's no real strong guidelines or textbooks because every case is different. But with a lot of experience and some of the studies that we have written and research papers we have done, we're able to come to some form of conclusion as to what is best for this person, both for their job and for the rest of their life. One of the best parts of treating athletes and professional athletes is that they're highly motivated. And generally, we know what their goal is. Their goal is to be able to play. And so anything we can do to help them play and to do it safely, they're eternally grateful for it. And it's a lot of fun to take care of somebody than to see them on TV and winning a World Series. Or sometimes I've treated guys when they were young and then forgotten about them and then seen them in the World Series playing, starting at shortstop or outfield. And that's obviously very fulfilling and rewarding because I knew them when they were an 18-year-old kid who was just having pain and hoping he could get a job and make a living doing this sport. So you really get the human element that a lot of these professional athletes, a lot of them are men, obviously, in most of the big sports in America, and they're all 20 to 25-year-old guys who are just trying to make it work and trying to do their job. We also treat a lot of women, golfers and tennis players and basketball players in just about every sport. So our real job as the spine surgeon is to be the patient's doctor. You know, we need to be their advocate, and they have an agent, and the teams are often on the patient's side. They want to help this person get better because they're an asset and they're part of their team and they want them to play. And that's why they drafted them or traded for them or signed them, is because they want to bring out the best in this person as well. So the trainer and the agent and the team and everyone else involved, usually everybody's on the same page. We all want this person to be able to play as effectively as possible. And so our number one job is to be their doctor and to be their advocate and to really just give them good, sound advice that they can trust on what decision to make. Because, you know, we're the experts in the spine. Until you've hurt your back, you don't know anything about it, or your neck. And you got a disc herniation, a nerve pain or weakness, and you don't know what that means. And so everybody who comes to us really is at a disadvantage that they don't have any knowledge. They don't have any information about their condition, and they're trying to make a life-altering decision without really any information going in. So our job number one is obviously to educate and then to give good advice as to what do we really think is best for them. And it really starts as a doctor as taking a proper history and physical exam, which is the first thing you learn in medical school. And it's always important not to veer too far away from that. Don't overlook things. Don't take things for granted. Don't get caught up in the hype and thinking, oh, this is right before a Super Bowl and everybody's on camera watching me on the sideline, whatever, taking care of somebody. Your job is to be the doctor and to start back with the basics. Take a history. Ask them what happened. Where's their pain? Where does it go? What happens? When does it come on? Do they have weakness? How does it affect them? Take a proper history and don't be in a rush and don't be distracted. Get them in a quiet room, one-on-one, where you can talk to them and ask them specific questions that you need answers to. And we get a lot of information secondhand. We may get phone calls from different people saying, oh, he's got this, he's got that. It's generally vitally important for us to talk to the patient directly. And obviously in the office or in a locker room where we can talk to them one-on-one is most important. Get a proper history. Number 2 is the physical exam. And that can be difficult, if you're not in the right setting or you just run into somebody in the hallway and they got all their uniform on and their cleats on, you don't want to disturb them. But you got to do a physical exam. You have to know, do they have weakness? Do they have numbness? Do they have a nerve problem? Do they have a limitation of motion in their back? So doing the basic physical exam is huge. And one of the things I picked up from my father, he does the most complete physical exam of any doctor I know, and he does it just about every time he ever sees somebody. But it's that repetition of relying on the same good habits and the same good foundation is how you don't miss anything and how you're always doing your proper job as the doctor. Starts with the history and physical exam, and from that tells us about 90% of the information we need to know. Then the next part is obviously getting the studies, reviewing MRIs and nerve tests and CT scans and x-rays and everything else. And the biggest thing about professional athletes is we order tests like day one. Somebody has back pain, we get MRIs, get all the x-rays day one. There's not a lot of waiting 2 to 6 weeks to see if it's going to go away. Because first thing is you got to make a diagnosis. You never want to miss a diagnosis. People can have little stress fractures in their back, which happen about 5 to 10% of the time in athletes. Well, if you miss that, it's considered a broken bone or a broken back if it hits the newspaper. Well, it's not really a broken back. It's a stress fracture, which typically heal. But you got to pick it up. You got to make the diagnosis. One, because you don't want to look bad and embarrass the team and the player and everybody else and yourself by missing a diagnosis. But more importantly is there's a lot of money. There's a lot of gambling. There's a lot of fantasy sports. There's a lot of everything riding on this. You got to make a diagnosis. So do the history and physical. Get the tests as soon as are reasonable to do. Make that diagnosis so at least you know what's going on. And in that vein, you got to make this right away. The hardest part about treating athletes is some guy may hurt his back and have back pain. And everybody kind of needs to know, is he going to be out 2 days or is it going to be 3 months? And the reality is when somebody first has an injury, well, we don't know. There's no way to know, has he structurally really injured the disc and this is going to take 3 to 5 months? Or is this just a little tweak, a muscle strain, a really small tear in the disc that will heal in a couple days? We don't really know, and there's not a lot of way to predict. We go by different things like the history and physical exam. How bad is the exam? If somebody's in agony, can barely move, well, obviously that's a lot different than somebody who's moving around pretty well. But also there's a lot of things we do on the exam that give us an idea as to how bad this problem is. Number 2 is how are they responding to the medications, to the anti-inflammatories, the oral steroids like prednisone, even doing an epidural. Are they responding to the treatment or not? And then the physical therapy and the back stabilization exercises, the one that we have in our Back Doctor app. How are they responding to the exercises? Are the exercises causing pain? Well, that's not a good sign because the exercises are designed to not cause pain. But if they're progressing through all the exercises, well, that's a better prognosis sign. But the hardest part is prediction of how long is this person going to be out when they have acute neck or back pain, because the bottom line is we don't know, but we have different factors we try and help determine that. Because I really empathize with the general managers and the teams. They got to know. They got a player. They need 25 players to play every night or whatever sport it is. They got a certain 12 guys in the NBA. They need to know. Do they need to go hire somebody else, need to make a trade? And so they've got decisions to make. And so my job is really to just give them as much information as we know to help them make decisions and obviously to help the player make a decision as to how safe is it for them to go back and at what point. And nobody wants to go back while they're still hurt because they're not going to be as effective. And so it's a balance between making sure they're safe, but at the same time getting them back, because there's no question about it. Everybody's goal is to play. If that's your job and you're not playing, well, you're not good to anybody, and we got to get you back as soon as possible. So time is of essence, and we got to get back as soon as possible, but do it safely. And so a big part of that is having a treatment plan. People can understand if you tell them, look, I don't know if this is going to be 6 weeks or 3 months. We can't tell right now. But everybody wants to know, okay, well, what's the plan? And especially if you tell a player that they should not play, well, why not? And what's the plan? What do they have to do to get back to play? We've had players who we've said, well, you got to get to level 5 of our Back Doctor app program. 5 is the hardest, 1 is the easiest. When you get to level 5 and you're not having pain, well, then you can go back to play. We've had players say, well, if I lay down on the ground right now and do a level 5, can I play tomorrow? These guys are obsessed. They're testosterone-driven, great athletes, used to being the top athlete in the world. A lot of people have told them they couldn't do certain things, and they've been able to do it their whole life. And so if you're going to tell them they can't go play, you better have a reason, and you better have a plan. You got to have a plan as to what do they have to do to get back to play, because that puts everybody on the same page and puts everybody at ease as to, well, this is what we're going to do. A lot of formulating that plan just comes with experience. You've got to have been in there a lot of times to know what's the most appropriate plan, and it's different for every sport. Football, their pain tolerance in football players is so high that a lot of times they have issues that they go back and play, and they can play the rest of the season with little limitation in an injury that in another sport the guy may be out for 3 months. Because every sport's different and the demands are different, the contracts are different, the expectations are different, and everything else. But you got to have a plan, and that's one of the things I love about our Back Doctor app program is it's a quantitative program that helps everybody be on the same page. When you start at level 1, when you get to level 2, we know your core is strong enough. You're typically safe to do an elliptical and to bike and to start swimming and to start some of your rotational activities. When you get to level 3, you can start more sport-specific exercises, hitting a ball, throwing, pitching, shooting, skating. Level 4, you can practice with the team, and level 5, we want most people at before they go back to their sport. So it's a way for us to quantitatively get somebody back to their activities and where everybody's on the same page. We can treat a guy from New York, and we can talk to the trainer and the physical therapist and tell them exactly what to do and guide them that way. And one of the big things in that is making sure everybody's on the same page. So we really try to talk to the agent, the team, the physical therapist, the player's family, all so that all at the same time so everybody hears the same message and there's no miscommunication. As far as when it comes down to surgery, nobody wants to have spine surgery. No normal person and no athlete does. It scares them. They're 25, 26 years old. Their whole job and their earning potential is for the next couple of years. And having surgery is very scary because there's a chance they may never play again. But the surgeries that are typically done for athletes can be highly successful. Microscopic lumbar discectomy is what we do for a herniated disc in your back, especially if that disc is pushing on a nerve and someone's having nerve pain or weakness that is not responding to non-operative treatment. If somebody has bad weakness that really affects their ability to do their job, like calf weakness in an offensive lineman, well, we may operate on them tomorrow because doing the surgery as soon as possible and taking the pressure off the nerve can give the nerve the best chance to recover and allow them the best chance to be able to get back to their job. We also give people sometimes 4 to 6 weeks to see if it's going to get better on its own, even up to 3 months. Sometimes if someone is still functional and able to do their job, well, we'll let them finish the season and then do surgery right at the end of the season. And basically a discectomy, removing the disc herniation for the lower back, lumbar spine, is one of the best surgeries we have. We published this in a scientific journal, 85 professional athletes in just about every sport, and 89% of them were able to return to their professional sport, and the average return was about 5 months. We also looked at if the player had their sport in season 3 months after the surgery, well, what was the chance they were back playing at 3 months after the surgery? And it was 50%. So that's great information because now I can tell teams and tell players, look, don't expect to be back at 3 months. There's about a 50% chance you'll be back at 3 months. The average is 5 months. Sometimes it takes up to a year to get back. There's been another study published that showed professional athletes who make it back to their sport after the lumbar discectomy, most of their performance is very typical to as it was before the injury and before the surgery. So that's good. So if they do make it back, typically they're able to perform with the same numbers and same stats as they did before the injury and before the surgery. The other most common surgery we do is a neck fusion, an anterior cervical discectomy and fusion. In the cervical spine, we're more likely to recommend the fusion compared to just the microscopic discectomy as we do in the lumbar spine, because in the necks, typically the disc herniations will hit the nerve, or their spinal cord. And going in the front and taking the disc out from the front is the safest, most reliable way to do the surgery, because we're able to take all the pressure off the nerve and off the spinal cord by taking the disc out from the front, barely even touching the nerve or the spinal cord, because the disc is in the front. So if you go in the front, we can take it out without really significant risk. However, if you take the whole disc out, you've got to replace it. And typically we replace it with a fusion, which is some bone and a metal plate with screws to stop the motion. That disc never moves again and the symptoms will not return. The downside to the fusion is it can put more stress on the levels above and below, which can accelerate the wear and tear at those other levels and may lead to other problems. The other surgery is we'll go in the back and do the discectomy and the microscopic foraminotomy from the back, but that has been shown in one research study to have a much higher rate of persistent nerve problems and need for secondary surgery, because you can still have nerve irritability. Whereas the fusion, where we do it from the front, is more likely to fix that nerve problem definitively. The risk is you may develop problems at the other levels. So most professional athletes, if they have pressure on their spinal cord, we go in from the front, do a fusion, because it takes the pressure off the spinal cord, and we need to protect their spinal cord to decrease the chance of paralysis and to give them the safest chance of going back to play. And if it's pressure on just a nerve root, then doing the surgery from the front takes all the pressure off the nerve safely, stops the motion, most reliably treats the nerve, especially if they have weakness, say in their throwing arm or their dominant arm, they need to do the sport. Doing the fusion gives the best chance of that nerve recovering so they can go back to their sport, play another 3 to 5 years, make enough money to make them comfortable for the rest of their life. The results of our study that we presented recently on neck fusions in professional athletes, we had 25 athletes and 80% of them returned to play professional sports. The average return was about 9 months. So the summary of treating professional athletes with spine problems is, it's obviously a lot of fun being down on the sideline, being in the locker room for different sports, getting to know the guys, and being invested in how they do and how they perform is obviously fun. And they're really just normal people who have a significant problem. They're scared, they're uninformed, they want help to get back. And you really empathize with them because they don't know anything about spines, just like no one else does. And being able to help educate them and direct them back safely with the program to be able to do the sport they love is obviously really gratifying. At the same time, you've got to make sure to not get too caught up in the hype. And part of the phrases that my dad and we say to each other are, one, don't do anybody any favors. So, and that sounds a little weird, but if you try and do people too many favors, like examining them in the middle of the street, not making them take their shoes off, not making them get a certain study because you don't want to be inconvenient to them, it doesn't do anybody any good. Treat them just like a normal patient. Do the full history and physical exam, get the studies. It's okay if it's inconvenient. Do what you need to do to help them the best. And remember that you're a doctor. Don't get too caught up in, are you this, are you that? No, you're a doctor. Your job is to take care of the person. They're a human being, and your focus is to do that. And the great part is, if you do that, well, everything else is pretty easy. If you do your job, you make a diagnosis, you treat them properly, you give them good advice, you do everything that's best for them, everybody else can sort out the contract, the return to play. That's all other people's business. That's their jobs. Your job is to take care of the person. If you do that, people will be grateful, you'll do a proper job, and people will come back to you for advice in the future. And, 95% of the athletes we treat, we never operate on. Most of them never make it into the press or anything else, and most we never operate on. We just give them advice, put them on a non-operative program, and they get back to their sport without surgery. We do epidurals. I do the epidurals myself. I actually trained in England for a year where I learned how to do epidurals. So we do the shots. I'll see a player. Sometimes they call me a Saturday night. They'll fly in Sunday morning. We'll get an MRI, get x-rays all at the hospital, examine them, take the history and physical, do an epidural. We can do all that within an hour and a half and start the process of getting them back to play. And then the guidance of our physical therapy program, which is the Back Doctor app, is vital for us helping direct the rehab and return to not only the sport, but to when can they run, when can they throw 60 feet, when can they start to hit, when can they shoot. All these little baby steps are what we have to help direct them. And having a quantitative program of rehab that we have in our back program is vital to being able to do that. And that's how we treat backs and necks. And our program is in the Back Doctor app. It's free at the App Store and the Google Play Store. Go to our webpage, backdoctorapp.com. We're happy to see you for a consultation anytime, and hope that helps in treating professional athletes. And if you are an athlete and you have spine problems, reach out to us anytime if we can help.